I'm Dr. Julie Schell from Beaubon Veterinary Hospital, and today I would like to talk to you about instrument-assisted soft tissue manipulation. So it's basically using these tools to help pets feel better. This can be done for all animals, and especially I do it in dogs and cats. And this is Kingston. The way you can tell if a dog needs this is definitely bring him to your veterinarian, bring her to your veterinarian, make sure that the reason for the injury or the sore area of their body is understood. So it's very important that your pet gets examined by a veterinarian first, and then your veterinarian might prescribe this type of treatment for them. It's kind of a chiropractic treatment. I learned it throughout my veterinary chiropractic training. And so what happens is if an animal's skin doesn't move and glide properly over itself and over the muscular layers underneath, and if the muscular layers don't glide over each other, then you can get discomfort. You can get a lot of adhesions and inability to move. And so sometimes when there's not enough glide going through these different layers, the fascial tissue creates adhesions. And this procedure, using these assisted techniques with the instruments, helps release the adhesions and makes the animal move better, and it decreases pain. And it also is almost a diagnostic tool too, because if there's a lesion that's not getting better with this blading technique, then you can definitely go back to your veterinarian and maybe they'll prescribe other types of treatments and do some more chiropractic or acupuncture. But yeah, it's very important to get as much diagnosis done as you can before you have this procedure done. So I'm going to show you how this is done. This is Kingston. He's actually acting very healthy today and he's moving very well. And so this is just for demonstration purposes. I don't feel that he has lameness. But I like to apply some essential oils first to help calm them. And this is a mixture of pine and blue tansy. We love it for animals, and you just kind of mix it into your hands. It's all diluted. We don't use it ever fully concentrated. We always dilute it for pets, and we just let them have the nice feel of that. I always like to take off all of their jewelry and their collars and everything. So I first kind of rub my hands through the body and just kind of feel if there's any areas that feel adhesed that aren't moving well. As you can see, Kingston has an extraordinary amount of extra tissue because he's a French Bulldog and he's in a good body condition, so he's nice and fit. And so all of this extra tissue just glides really nicely. And as you can see, it's calming him down already just by relaxing. Here comes Treza. She wants to have some as well. And that's what I find too, like often if I'm working on one of my pets, they'll all come and they all want it done. So that's a good thing. So I'm just kind of feeling if there's any major adhesions. And for him, he feels really good. And I was working with him last night as well. And so what I do first of all, if he was needing this, which all animals need this, even if it's not for therapeutic purposes, it's also good for massage and for relaxing them. I like to use this instrument, and I often will use it with the more smoother blade first. And I just use this instrument down his back, not right directly on his spine, but just down the paraspinal muscles, and they're called expaxial muscles and hypaxial muscles, and you can kind of feel if there's any sort of glitch in his skin, or if there's like an area that kind of doesn't feel like it's flowing smoothly. So I just kind of go down, and he's a very muscular boy, so he has a lot of big muscles in his neck and his front arms and his head. Even his TMJ, the joint of our jaw is very, very sensitive. There's thousands and thousands of nerve endings there, and so it's nice to be very cautious around that area. And I find dogs that bark a lot definitely have injuries and discomforts and malalignments in their TMJ, so it's good to get some chiropractic care for sure. And as you can see, Kingston just loves this. What I'm doing now is just kind of like feathering strokes. I'm just kind of like feeling, and there's different touch receptors of the skin, and there's interoceptors, nociceptors, thermoreceptors to detect temperature, nociceptors to detect pain, mechanoreceptors to detect pressure. There's a whole bunch of different neuroreceptors in the skin, and so this this therapy basically stimulates those and helps the body improve circulation through the areas that need it. And if there's an adhesion, if there's an area that seems extra tight, then I'll often use another stroking method. It's kind of like chopping method, and it will help dislodge the adhesions very nicely. And sometimes I'll find that the dog leans into those areas, and you can detect even muscle knots like deeper down. And so you can do that kind of therapy. And then at the end, like usually this only takes about 90 seconds. We don't want to overstimulate the dog, and that will upregulate them sometimes, or they might not like too much stimulation. And so near the end, I will kind of stimulate the Pacinian corpuscles, as well as at the very end, I'll do Ruffini corpuscle manipulation. So it's just basically slow, steady strokes to kind of down regulate him. As you can see, Kingston is very calm with this procedure. He doesn't mind it one bit. He loves it, and it just makes him feel really, really good. And basically, yeah, if you have any questions about this procedure, definitely give us a call at 403-278-1984, or check us out online at www.bobottomvet.com. Thank you very much.